Dell and Intel are dedicated to assisting the NHS in testing the use of mobile technology whilst qualifying and quantifying the benefits so that well-informed investment decisions can be made.
Hello, I'm a community matron working in Hammersmith and Fulham. Just to recap, if you don't know what a community matron does, I look after patients that have long-term conditions and they're pretty much housebound. I'm firstly going to explain how I worked beforehand and how this laptop's completely changed my working day. My base is in White City Health Centre, which is the north of Hammersmith and Fulham, and my patients are literally based anywhere. So from home, I had to go into the White City Health Centre to collect my patient notes before I went out to see my first patient. I could then discover a problem that needed fast action, which might mean perhaps a telephone call to the GP, but invariably I would feel a sense perhaps of urgency to get back to White City Health Centre, to get those faxes off, to email a consultant, to talk to people. Also, if I got a telephone call out and about, maybe I hadn't seen that patient for 6 weeks, I couldn't actually remember the details of that patient, and in order to see them, really I'd need to go back to White City Health Centre in order to get their notes. The first thing that happens in my day is that I open my diary at home. I don't go into White City Health Centre, I go straight out to see my first patient.
Hiya.
Hi.
Nice to see you
And
again.
you?
How are you doing?
So I'm there in the patient's home and I'm accessing their data, and I can see straight away what's gone on the week before, the day before. But I can also, if I've got a problem, I can use my nhs.net from the patient's home, and I quite frequently do this. I say, I think we need to consult someone about this and get a second opinion. The patient finds the fact that they're being consulted at home by a cardiologist quite exciting and reassuring. From the patient's home, I also organise equipment. I can organise an electric bed, an electric chair, footstools, pendant alarms. I think the patient gains something from knowing that that job has been done, and actually knowing that they actually negotiated with me. I actually do frequently drop into coffee shops now to complete some of that work.
Based on the findings from multiple trials commissioned by Dell and Intel and independently monitored by Ignetica, typical performance benefits have included: release 30 to 60 minutes of time per day, reduce work time travel by over 30%, increase productivity by 25%, reduce clinical risk with live information, improve patient experience, improve user work-home life balance, support wider CRS EPR usage, potential to reduce commuting by up to 50%, supporting CO2 reduction, create net economic value of over £250 per month. Dell and Intel have developed a range of support services to help trusts evaluate, plan and deploy mobile working solutions, drawing on the insights from these trials. Please contact your Dell account manager for more information.